My name is Brianna Walker, and I will be discussing with you why eating disorders should be considered a mental illness. Did you know that at least every 62 minutes, one person dies as a direct result of an eating disorder? In today's society, the debate on whether eating disorders should be considered a mental illness has become a popular debate. There are many different forms of mental illnesses ranging from depression to autism. But a common one in today's generation is eating disorders. Eating disorders are defined as disturbed or abnormal eating habits. A few signs of an eating disorder would be obsession with food, body, weight, and shape. At least 30 million people of all ages suffer from an eating disorder. These disorders are becoming more common in today's society due to different influences in social media and body standards. And many people believe that it is a lifestyle choice rather than an actual mental disorder, claiming that people with an eating disorder are only doing it to get attention or because they are doing it to themselves and can stop whenever they choose. This is not the case. Eating disorders should be considered a mental illness. First, there is medical and scientific evidence showing that certain eating disorders are heritable. Second, eating disorders have been shown to alter brain structure, metabolism, and neurochemistry. Thirdly, eating disorders are life-threatening illnesses associated with countless medical complications and extreme medical treatment. Classifying eating disorders as a mental illness would allow people who have these disorders to feel more confident to come forward and get help. Eating disorders are serious behavior problems that can include starving oneself or overeating, causing a person to be unhealthy, mentally and physically. According to the Diagnostic and Statistical Manual of the Psychiatric Association, eating disorders are broken down into 8 different categories, including anorexia nervosa, bulimia nervosa, binge eating disorder, avoidant/restrictive food, intake disorder, other specific feeding or eating disorders, unspecified feeding or eating disorder, pica, and rumination disorder. These disorders cause a person to be paranoid about their shape and weight. All of these conditions have extreme weight and food problems, but all have different symptoms. Anorexia nervosa causes people to deny food to the point of starvation and constantly obsess about their weight loss. Bulimia nervosa is a disorder in which people feel out of control when binging on large amounts of food in a short period of time, and later try to rid themselves of the extra calories using different methods. Binge eating disorder is when a person loses control of their eating and eat a lot in a short period of time. They are more common in teenage girls and go along with substance abuse, anxiety, and depression. Although they are more common in teenage girls, at least 30 million people of all ages and genders suffer from these disorders in the U.S. Eating disorders can create many other health problems, including heart and kidney problems. There can be many different causes of eating disorders, including genetics, environment, peer pressure, and emotional health. But one that many people don't realize is even in the range of causes is the disorders being heritable. Studies have shown that eating disorders can be heritable. Research involving family, twin, and adoption of anorexia nervosa, bulimia nervosa, binge eating disorder, and the proposed purging disorder had demonstrated consistently that genetic factors contribute to the variance in liability to eating disorders. Another evaluation that has provided further insight regarding genetic factors involve endophenotypes and component phenotypes, influencing eating disorders and eating disorder diagnostic criteria. These phenotypes have demonstrated substantial heritability. When thinking about the effects of an eating disorder, one particular piece of evidence is rarely acknowledged. This is how eating disorders affect the neurobiology of the brain. It is very clear that a person's nervous system, including their brain and nerves, are negatively impacted when someone obtains an eating disorder. Research from the Emily program has found evidence showing different ways the nervous system is actually affected. Disorders cause disruptions in the behavior of neurotransmitters, which are chemicals that transmit signals from one nerve to another. The brain physically shrinking both gray and white matter, and although there is so much more to learn about how eating disorders affect the brain, this is enough evidence to show that it is a mental illness and should be treated as one. Eating disorders are among the most difficult conditions to treat. Research at NIMH institutes are assisting healthcare professionals in furthering their knowledge on their patients. Due to misperceptions, many people do not get the help they need to recover.
Coach White, Mr. Wampler, call the front desk, please.
Dr. Thomas Insel, the director of the National Institute of Mental Health, states, The most important thing to recognize is that these are real disorders and that require treatment. Conducting an official diagnosis includes a doctor doing a physical examination and running lab tests. Catching these disorders early causes an easier recovery. In conclusion, people need to be aware of what they are dealing with when they or someone they love are faced with an eating disorder. When this illness can affect 1 in 20 people, men or women, there needs to be more information available so they know how they can help. When borderline on whether they have this disease or not, a question to ask yourself or the person you're concerned about is, what percentage of your day do you spend thinking about food, weight, and the shape of your body? This question could help show someone whether they need to get help or save them from continuing to hurt themselves without even realizing it. Mental illnesses are very serious, and eating disorders should be incorporated into the category of mental illnesses, especially considering there are so many mortalities caused by them every day.